Hello, and welcome to the Bridging the Gap interview series. I'm your host, Chris Molaro, CEO and co-founder of NeuroFlow. In this series, we talk to a variety of different healthcare entrepreneurs, innovators, leaders, and health systems, payers, vendors, the like. We're going to talk about a variety of subjects. It's going to be interesting. We're going to learn a lot. And we're going to push the envelope so we can help get people better faster. My guest today is Dr. Stephen Klasko. He's most recently the president and CEO of Jefferson Health, now an executive in residence at General Catalyst, among a bunch of different things. Steve is an OBGYN by training, delivering over 2,200 babies in his career. He's held executive positions as Dean of Drexel. He was the CEO of USF Health, as I said, president and CEO of Jefferson Health, and has been known and built a brand around being an innovator and disruptor in healthcare. Pushing the envelope in terms of expanding Jefferson Health's footprint, consolidating the market, buying health plans, and really innovating, partnering with places like Silicon Valley. Steve and I in this episode will talk about a variety of things, from how to help hospitals help themselves, how to get new technologies in there. We'll talk about his journey and what he's learned over time and what helps move the needle. We'll talk about everything from societal changes to policy changes. And the fun part is Steve actually is a DJ in his free time. And so we'll talk about his new book out there that ties in music and healthcare and how we could see the synergies behind different lyrics, music artists, and different themes today in healthcare. Hope you enjoy the show. Thanks for joining me, Dr. Klasko.
Well, Chris, it's really great to be here. And, I feel like, I'm an obstetrician, and I almost feel like, when you part of a birth of a baby. I was around when NeuroFlow was birthed.
That's right.
And every once in a while I have patients sending me pictures of the kid I delivered like several years ago. So it's great to see what's happened to NeuroFlow and just a lot of credit, but most importantly what it's going to mean to patients and providers at a very difficult time in healthcare.
Thank you for that. Appreciate that. So you said you're an OB.
I am.
How in the world does an OB end up in your position now as president and CEO of multiple hospitals and VCs and traveling the world?
Well, even worse, a private practice OB that had never done anything academic and became president of a university. I think the best advice I can give you is don't listen to people's advice. If I listened to people's advice, I'd still be delivering babies in Allentown, Pennsylvania.
That's funny.
But the 30-second version of that is 97% of OBGYNs in 1982 were male, and the number one performed procedure in this country was hysterectomy, followed closely by C-section. And I happened to listen to a Penn State, as I remember, very old male OBGYN, actually probably my age now that I think about it, but talking about hysterectomy, and said, if you see a small fibroid, just take out the uterus because a woman doesn't need that after she's had her children. Happened at Barnes & Noble that night, and 4 of the top 10 nonfiction bestsellers were from patients. What my hysterectomy did to me, hysterectomy hoax, how a hysterectomy ruined my life. So everybody told me I was nuts, but I took an 80% pay cut and went into academics and looking at the psychological and sexual effects of hysterectomy, and then went out to Houston and helped folks develop some of the.
So you left private practice?
Left private practice, took an 80% pay cut as a sort
and you started doing research?
Professor, started doing research on psychological and sexual effects of hysterectomy. Then took a further pay cut, went out to Houston with some of the people that were developing YAG lasers to avoid hysterectomy and helped with a couple patents.
Your research is basically saying, don't do hysterectomy?
Well, no, it was just that you could actually predict who's not going to do well psychologically and sexually that can actually ruin their life. So, for example, in certain cultures, the uterus is considered the, where femininity starts, at least to the male.
Right.
So unless you had that discussion before, the husband or partner was going to be much less interested in her. And, if you know that before,
then
you can
at
least, do some things to talk about that and from a behavioral point of view, or, preferably not do the hysterectomy, because we did way, way, way too many. So that's really defined my life. And then I moved up an academic career in the 90s. Everybody was complaining about managed care, and I was listening to these neurosurgeons that can take out small tumors from the brain, complain about business. I went to Wharton and got my MBA. figuring I can deliver an 8-pound baby, I can probably figure out business. And I got almost $1 million grant to look at what makes doctors different than, depending on the audience, either other people or normal people, and how we handle change.
Yeah.
And that led to being the dean at Drexel University College of Medicine, the dean and CEO at University of South Florida, which interestingly is not in South Florida, it's in Tampa. And
it's like mid-Florida.
And then the president of Thomas Jefferson University and CEO of Jefferson Health. But the reason I started out that way is almost every job I took, including Jefferson, smart people told me not to take. And
really?
And so it was. I just sort of jumped into things, and by the time I got to USF and stuff, I figured I was playing with house money. The fact that I was private practice stock as a dean, I was playing with house money. And,
right.
So that's why I was always willing to be more transformative and take some risks that maybe others wouldn't.
Yeah, I was going to ask. It almost seems a very unique kind of mindset in healthcare, unfortunately.
Yeah. Oh, yeah. I mean, I think there's a lot of leadership in healthcare that aims not to fail.
Right.
And I mean, as you know, in your world, and certainly in my world now with General Catalyst and Shiva and Abundant, just playing for a tie doesn't work. I
right.
call it the Super Bowl 50s phenomenon. If you remember, the Patriots were favored by 20 points.
Yeah.
Atlanta was, just killing them.
Right.
Third quarter, just
27-3, I think.
Yeah, it was 27-3, and I was having a great time because my son-in-law's an obnoxious Patriots fan, and I was just laughing at him. And in the fourth quarter they decided to play not to lose.
Right.
And they lost. And so I think, that was the difference at Jefferson. I mean, we did 7 mergers in 6 years, but we gave incredibly great care, but we were a 2-hospital system that was really losing money that nobody was paying attention to. And after we merged the university and the hospital, which everybody thought, wow, that's going to take 5 years. We did that in 6 months.
Right.
We left the merger with Mainline Health. Then when we got to Abington, everybody said, okay, now just digest that, and maybe 5 years from now. Well, that wasn't where we were heading. We were heading to become, basically a 197-year-old academic medical center, thinking like a startup company, and becoming the largest health system in Philadelphia.
Right.
When I told the Philadelphia Business Journal that in 2014, John George, to his credit, was the only person who didn't laugh. But people that read it, laughed and said, "This guy's
so you thought you were crazy
or on drugs, right?"
Yeah.
And I'm not on drugs.
So maybe a little crazy.
It's up to who you talk to. Yeah.
Well, I guess so being in healthcare now on the vendor side, where we partner with health systems, it's frustrating sometimes. Where you're trying to inspire this change for good, and it's like you're in quicksand. I mean, I guess it's not a scalable business model to find Steve Klaskos everywhere to innovate with. So, I mean, wanting to innovate in healthcare, how would you recommend others pursuing that? I mean, whether you're on the system side or the vendor side.
Yeah, it's really a great question, and I think part of the issue is we have become so risk averse and over administered in the traditional healthcare ecosystem. I did a thing for Gates Ventures where Bill Gates woke up and recognized that we have something like 30 times the amount of administration in our healthcare system compared to other countries, and some of that is regulation, some of that is just this risk aversion, predominantly of not-for-profit boards. Mm-hmm. So if you think about the chief legal officers and the legal team, right, at an academic medical center, they will not get in trouble for saying no. And in fact, it was funny because I gave a talk for all the J&J lawyers one time.
Yeah.
Skorsky's a friend, and somebody asked me.
He was your Wharton classmate, right?
He was my Wharton classmate.
Yeah.
We've been friends for 20 years.
Awesome.
And he's just a great guy. But so he said, I'd like you to talk to our lawyers. So there were all these lawyers, and one of the Philadelphia said, look, I got to ask you, Jefferson was probably the most conservative place on the planet. Then you get here and you're doing all these things. You're merging with a design university. You're doing 7 mergers. Right. You're out there with VCs. Did you have to, get new lawyers? I said, no, we have the same lawyers. We just asked a different question. So what do you mean? I said, well, we used to ask, can I do this? And 90% of the time the answer would be no. Right. Because it's easier to say no. Now I say, all right, I'm about to do this a week from now. How do I stay out of jail? And about 80% of the time, well, it would be, we'd rather you not do this, but,
Right.
And then 20% of the time would be the, no, I don't think we can find a way. And those would be the 20% of things you didn't do, as opposed to the 90% of things you didn't do. So I think it's not anybody's fault. And I just think that we've been able to survive, Chris, with that risk-averse mentality, just
Right.
doing the same thing, being more inefficient, being more lethargic
Keep the status
in a way,
quo.
and then going to the insurers and saying we need an extra 4% because we're more inefficient. That's
Right.
that's obviously all gone, which is why we're stuck in this sort of ways. The payers now have a lot more of the ability to manage things, and we don't have a playbook. You're an athlete. The key to almost any game is what happens in the second half.
Right.
Right, and getting back to that 27-3, whatever they said at halftime, we got to do differently. Bill Belichick is great at that. So
Right.
we're not good at that.
Healthcare, you mean?
The traditional healthcare ecosystem
Got
is
it.
not good at that, and that's true across.
Right.
Now, a place like United has done that with Optum, but if you look at the Blues in this country, they have a playbook, and if that doesn't work, they don't have a second play.
Right.
I think that was really the thing that I'm really proud of, that our team, and we had to bring in some people to do this. We had plan Bs, plan Cs, we had a playbook.
Yeah.
And when something didn't work, or when somebody was angry about something we did, we had the next step. And I think that's my advice to leaders. And by the way, I think that's true in your world now too.
100%.
Right? I mean, when I first got to GC and others,
Yeah.
if you had AI in your title, you were worth $2 billion. So it's like, why do we need Steve?
Yeah.
Now that everybody's going out, and some people have to get debt and stuff, and
Yeah.
they're being told by Morgan Stanley they have to be scalable and sustainable.
Right.
A lot of these founders, that's the first time that they've had that situation. I'm like Mr. Miyagi and Karate Kid. It's
Yeah.
like, Dr. Klasko, can you tell us, how we become scalable and
Yeah.
sustainable? So I think that adaptability and that ability to think flexibly, nimbly, and agilely is something that we clearly don't have in the traditional healthcare ecosystem, and I think new leaders will need that. And interestingly, even though it's predominantly a much younger group, not always true in the VC and founder ecosystem.
Yeah. Do you think that the shift towards value-based care is helping this, or we've been talking about this for like 2 decades?
Yeah,
right?
that's what I was gonna say. I think, it's so funny because you mentioned that, because I gave a main stage thing on HLTH. It's called The Holy Grail of Value-Based Care and Preventive Health.
Mm-hmm.
And I said, I love this title because we've been looking for the Holy Grail for 2,000 years.
Yeah,
And watch
exactly.
Indiana Jones.
Yeah, that's right.
And we've been talking about value-based care and preventive health for almost the same amount of time.
Yeah.
So the answer is, the problem is that at this point, value-based care is still a myth, cynically, or an aspiration, if I wanted to be kinder, right? So,
Yeah.
I mean, I give talks around the
In
country.
most cases, right?
In most cases,
Yeah.
yeah. I mean, and it's going to get there. I mean, there's no question. I think the post-COVID thing is going to be, a nidus. But if you talk to most health systems,
Yeah.
community health systems around here, and say, what percentage of your actual revenue
Yeah.
is at risk on the downside or upside? In a good day, it's 20%.
Really?
Yeah. Now,
You have the exceptions out there, right?
Oh,
But,
yeah, you have some very successful exceptions, and I think, you have things like, the whole provider world has changed. The largest
Yeah.
provider in this country is
Yeah.
Optum.
Really?
Healthcare.
Are they bigger than the VA? Do you
Yeah.
know?
Well, I don't know about that.
Okay.
Yeah.
I mean, because that may be. Yeah.
Well, let's take the VA
Okay.
aside.
Okay. Yeah.
But I mean, as far as
Yeah.
any provider group,
Mhm.
and the problem with looking at the VA, different issue, but some of those folks aren't full-time VA, and
Yeah, that's true,
right?
yeah.
I mean,
Or affiliated with-
we had one of the largest VA. We had actually 2 VAs when I was at USF, Haley VA and Bay Ridge. And,
Oh, really?
and actually, I had one of the largest PTSD VAs in the country.
Huh.
The fact is, a lot of those folks, worked at USF and worked at the VA, so it's a little harder to get numbers. But be that as it
I get
may,
it. Yeah,
if
yeah.
you would have thought that an insurance company, for all intents and purposes, would be among the largest healthcare providers, and Optum was sort of, just the tail of the dog that became the tail that wag the dog. Now it's the tail that ate the dog.
Yeah.
I mean, if you look at
It's bigger than UHG?
UHG, I think.
Is it?
Yeah. So look, I think that part is changing, and And even, Chris, even for a company like NeuroFlow, who you're selling to, I think, is going to change a lot.
Right.
And this
what do you mean by that, Ken?
Well, the traditional thing is you're knocking on doors of health systems.
Right.
And that will make you need NeuroFlow for behavioral health services because, our average amount of time from the time we decide to do it to the time you get the contract is something like 12 to 18 months in this country.
Yeah.
It's all the
I think that's a fair estimate.
Talked about. But where a lot of healthcare is going is outside of those traditional healthcare ecosystems.
What do you mean, like private equity backed practices?
Well, yes, and so look, where does the orthopedics happen in Philadelphia? I mean, honestly, you want to make a change in orthopedics surgery. It's Rothman Institute.
Right.
Now, Rothman Institute is the
that's part of Jefferson.
Well, they're not actually. I mean, they're a totally private group.
I didn't know that.
Yeah.
So,
that works at Jefferson, works at Capitol Health.
Really?
Works at Kennedy. Has a whole group in Florida and New York, of which Jefferson has nothing to do with. They're a private group. All the revenue comes into Rothman Institute. There's some financial sharing for the academics and research and stuff, and they are Jefferson's academic partner. Totally private group. But the reason I bring that up is so if you wanted to sell something to orthopedic surgery,
you'd go to Rothman.
You would not go to Jefferson.
Right.
You would go to Rothman. That's true, by the way. The largest orthopedic surgery group is a group called HOPCO. Now, again, they might work at 10 hospitals.
Right, but they're private.
But their number one thing is not, what's good for the hospital.
Right, exactly.
Right? In women's health, same way. You might say, oh, God, I want to sell something. I was on the board of a company that was doing remote obstetric monitoring. I want to sell something, on women's health. I better go to hospitals that do a lot of deliveries. Well, you could do that, and you knock on a lot of doors. Or you could go to Axia or Unified, which combined have something like 1,500 women's health providers.
Huh.
And then you add the whole private equity component, which is starting to add to
consolidate them too, right?
Those. Or even cardiology. There's a company that I'm working with that's sort of looking at how they can make cardiology more value-based. And I got them in touch with cardiology consultants in Philadelphia. It's a group with a couple hundred cardiologists. They work at Jefferson, they work at Mainline, they work basically at 9 or 10 different hospitals.
Yeah.
But they're going to be much more interested in value-based stuff that gets stuff out of the hospital.
Right, and gets them to their clinic.
Right, it gets them to their clinic, and that's where the value is. Whereas it's hard to get somebody to do something when their salary depends upon them not doing it.
Right.
My chair of cardiology in academic medical center might recognize that things are going to go out of the hospital, but that might not be the first thing that he wants to do, since a lot of them are paid on the traditional RVU piece, which, by the way, is part of the reason why value-based care is taking a lot longer.
Longer than everyone expected, right?
Yeah, I mean, there's a company that I'm working with that's looking at infertility services. It's called Uva. It's based out of Philly. It's a woman from Wharton that started this, but stuff that might cost $6,000 in a hospital every month to get done.
Right.
In infertility can be done now at home, and
brings down the cost significantly.
Brings down the cost by maybe 10 times.
And I bet you better consumer experience.
Right, better consumer experience. Yeah. And I brought it to academic medical center chairs, and I thought they'd say the technology isn't as good as what we did. They said it's amazing. It's just as good as what we did.
That's awesome.
I say, so you'll use it? Oh no, we'll never use it because my doctors get paid on RVUs, and I'd be asking them to do something that would go against their incentive. So until we really have that payer-provider alignment is my point. Now.
Well, let's talk about one system that does have that, and I know that you were involved with, is down in Florida, the Villages.
Yeah.
Villages. So for those that don't know, the Villages, Google the Villages. It's not talking about Villages Health, just the community is is an amazing place. It's
200,000 seniors.
Yeah, and there are significantly more golf carts than there are cars.
Right. The least amount of loneliness of any place of any seniors on the planet. Also, supposedly, according to the study, the most amount of sexually transmitted diseases might be related. Let's see, sunshine, alcohol, and no risk of pregnancy. What could go wrong?
So a lot of, all right.
I'm speaking as a gynecologist.
But when I was we work with Villages Health down there, which we'll talk about. But when we were down there, it was crazy because 6 p.m. the places are packed.
Yeah.
And by 8 or 9 p.m., they're not packed anymore. And it was just now the Villages Health has a relationship with UHG They have a fully at-risk model, and they've done some really phenomenal stuff with integrated care
Yeah,
there.
we were the first academic partner at USF. I started with a cold call to the person that owns that, where I and the guy that named our medical school went up, and then Elliot Sussman, who took that over, then the CEO. We had Valley Health Network, and then brought in, when I left USF, my CEO of the practice group, Jeff Lowenkron, and so
he's an internist too.
He's an internist from Kaiser, so he had that whole life. But the reason it works, Chris, it's the exact opposite of the traditional healthcare system, right? The traditional healthcare system is generally run by subspecialists. When you think about who, it's the orthopedic
like
surgeons,
a neuro guy.
it's the neurosurgeons, it's the cardiovascular, right? Because that's where the revenue is coming into hospitals. And family medicine is really off into the side. I remember when we started our ACO with Mainline Health, I went to our chair of family and community medicine. I said, good news, you're going to get to be the quarterback of this new system. And he said, well, Steve, it's interesting because you pay me like the kicker. You pay the neurosurgeons and the cardiologists and orthopedic surgeons like the quarterback.
Like the franchise.
So if you want me to be the quarterback, maybe we should think about a little bit differently about payment models. So they did that. They basically said, look, we're going to bring in 50 primary care docs, and they are going to run the system. We're not going to have...
The ACO.
They're going to run basically the whole village's health.
Huh, okay.
And we're not going to have any hospitals. We're not going to necessarily have any specialists, but we'll pick our specialists.
Right.
And if somebody's ordering 3 nuclear scans, that's not where they're going to go.
Right.
And we're going to partner with United and Humana and Florida Blue to basically really do value-based care right.
And take risk and everything.
And take risk. And so they have an MLR of 60 with a risk-adjusted factor.
MLR, for our listeners,
is
is
medical loss ratio,
Yeah.
Which is best in breed.
Yeah.
And then I think a risk-adjusted factor of like 1.62 or something. So there's just nobody like them.
phenomenal. No.
But but
can you replicate that elsewhere?
Well, you can. I think the place to start, and this I think would be good advice for anybody that's starting a company around value-based care, is to look where there's total payer-provider alignment. So, now it's easy in places like UPMC.
Would a Geisinger be an example?
Geisinger would be a great example, and Jefferson became an example because I was able to acquire a Health Partners plan when I was CEO, which is a Medicaid and Medicare Advantage plan. But there's 2 areas where most large health systems have some payer-provider alignment. One is in their employees, right? So we tried a lot of things. That might have even been true with NeuroFlow. Like, we had 30,000 employees. We were their payer, provider, and employer. So that's perfect, right? Because that's where we started with Livongo, for example. Because there's no question, I want them to be out of the hospital. I'm paying their any hospital rate, even if it's Jefferson. So obviously, we want them to come to Jefferson if they need a hospital.
Right.
But that's where we started a lot of our telehealth programs because we couldn't get the insurers caught up. So that's one. I always tell founders, start with the TPA and the employers, because in most cases, health systems are the largest employer in the city.
Now, in that situation, would you, like with the Geisinger, for example, full alignment, they're an IDN, but they have a health plan, payer arm, and then a system arm. For Jefferson, you have Jefferson, the system, and then the HPP.
Yeah.
Is there a better entry point than one or the other?
Well, it's a great question, and I think some of this is, we talked about this a little bit, consumer segmenting your pitch, and really, I don't think a lot of sort of new companies spend enough time thinking about who that should be with.
Right.
So if you have something that you think is going to be good for, Geisinger, let's say, 2/3 of their revenue, I believe, comes from their insurer.
Right.
So I would talk to, I would say I would love to get a meeting with the chief clinical officer of the system and the person responsible. I always look at where the incentives are.
Right. Follow the money.
Who is incentivized for reducing costs, let's say in behavioral health, at Geisinger Insurance, and at it's probably the CCO at Geisinger System and somebody in the guy. I'd like to meet with them because I think I can cut your costs and give you better patient outcomes by X%.
Right.
Okay. They'll do that meeting, and then you'll be at the right place. Now, if you're going for in a place that doesn't have any payer provider alignment like that, or a place like Jefferson was before we got HPP, then sometimes it's really good to include the chief human resources officer.
Oh, interesting.
Because that person is responsible for the benefits,
Right.
for the 30, in our case, 30,000
With the employees. Yeah.
So that's why, something like Livongo was really interesting
Uh-huh.
to, at that time, our Chief Human Resource Officer. The other place, by the way, that I think is starting to accelerate that is the Medicare Advantage plans. So if you look at the ACO that we did in Philadelphia, it was with Mainline Health. And there wasn't enough juice in the Medicare Shared Savings Plan, but we were able to partner with Humana and look at Medicare Advantage. There's something like 60,000 people that go into Medicare in Philadelphia every year.
Every year.
And not nearly enough people go into Medicare Advantage, where there's really an opportunity both for the patient to get sort of better, more cost-efficient care, and for the entities, it's truly value-based care.
So we've been doing work with Jefferson. Like you said, you've seen the birth of the child. I mean, we were founded in Philly, also a Wharton grad, 5.5 years ago. Started with Jefferson under the premise, NeuroFlow is not a mental health company. We are approaching overall health through the mental health lens. So we partner with, before we worked with Jefferson, we were partnering with primary care and pain management providers to help them integrate behavioral health in their practices. Somebody that's in chronic pain every day has depression or anxiety. You and Dr. Meyer came to us and said, we'd like to take that philosophy but put it in our OBGYN clinics for mothers with postpartum depression and so forth, and we've grown since then.
Just for your audience, both Dr. Meyer, who's the president of Jefferson Health, and I are both OBGYNs. So
that makes sense. But there's a significant need there, and the interesting thing is when we look at BH costs, they're really a small piece of it. What we're looking at is the medical costs that are increased because of the co-occurring BH need.
Right. First of all, Chris, I said this at the beginning, but you have you created a company that really was the right company for the right time and will go well into the future. When I say that, there are some companies that are either fee for service or value based, and I think the thing that hit Bruce and I about NeuroFlow is you were ready for now, at least at that time, a couple of years ago, and 20 years into the future where it will be everything will be much more logical and value based. But I think that sometimes people don't realize the pressures of a health system. And just how it works. Since we have to see everybody, and since that's in our mission at a place like Jefferson was we improve lives, anything we can do to provide better care at a lower cost to everybody just makes so much sense. And behavioral health was such a sink, both for families and for the health system. But even things like, we had one of the largest refugee clinics or undocumented folks in Philly. And in OB, and I remember somebody said
at Jeff.
And I remember somebody said, "Well, why are you spending time doing that?" My guess is, was somebody that, wasn't thrilled about all those people in Philly, and I explained to them, well, first of all, our mission is to improve lives and their pregnant lives. But I said, let's say I didn't care about people.
Right.
The simple fact is, the way it works at hospitals, it wasn't me, it was God that decided 9 months from the time that person got pregnant, which I had nothing to do with, she was going to deliver. And if she shows up to my emergency room without care, the chances that kid will be in a neonatal intensive care nursery, the chances that it will be a much more expensive visit, the chances that kid will need, some other costly care with a patient that is either under or not insured. So even if I didn't care about improving lives, it's even a good business decision, because having my medical students, residents, and faculty just sort of keep that patient healthy and having her deliver a normal baby and going home the next day is a really great financial move. So it's really the same thing with what you were able to do, starting with OB. Behavioral health and OB was such an important piece to those patients. And when we changed our vision from being the premier academic medical center in Philadelphia to we improve lives, a company like NeuroFlow just made so much sense, but it also made financial sense.
Yeah, because the right thing and the good thing.
Yeah, and the more that we can take care, behavioral health is so underpaid for. And you're not just a behavioral health company, but I always laugh, and in my new book we talk about this.
Yeah, let's talk about that. What do you talk about in your book?
Well, the new book is basically, this is a passion project, because I started my career as a DJ, Chris. As you know, in Philadelphia WISP,
I think you're the only healthcare CEO that's also a DJ.
Yeah, well, I was it's funny because I just DJ'd an IPO out in Silicon Valley, and one of the young people said, when I told them I started as a DJ, said, "Oh, was that when DJs made less than doctors?" I said, "Yeah, that was pre-Pitbull." But so basically the concept of feeling all right, how the message in the music can create a healthier healthcare, really is everything I learned about being a healthcare leader for 40 years, I learned from being a DJ for 45 years. So it's basically a whole playlist.
Yeah.
But every chapter starts with the song. First chapter is Courage to Change. Everything we talked about. Health system leaders needed courage to change. That's a Sia song. Second one that you'll agree with is Simon & Garfunkel, Keep the Customer Satisfied. And the forward is by one of my mentors in DJing, Jerry Blavitt, the geeter with the heater, the boss of the hot sauce, who unfortunately just passed away. 1,200 of us were at his funeral on Saturday in Philadelphia. But the point is, music it's more than just a cool hook. Music to a lot of us is emotion. Chris, you probably remember the song when you met Erica. You might not remember, even where you were. Like, I remember when I met Colleen. I remember the song was playing. It's actually an interesting fact because it was Skating Away on the Thin Ice of a New Day by Jefferson.
Were you on ice?
What?
Were you skating?
We were actually at the Rockefeller Center, which was, we weren't skating, but it was right by the.
That's awesome.
And but my point is, you remember that it's an emotion, and every when you think about what my leadership team at Jefferson had to deal with during the pandemic. Maybe $500 million of revenue going away, just the toll on our 35,000 employees. And then we were right in the middle of George Floyd,
that stuff.
Systemic racism protests. And I did a playlist every Friday.
For the employees?
For all 35,000 employees.
No way.
Which, and this was written up in one of the Wharton magazines and stuff, but that probably was the single most important communication, because it was a two-way communication. When the George Floyd stuff happened, the songs that week were things like Choice of Colors by the Impressions. If you had a choice of colors, which one would you choose, my brother? If there was no black or white, which would you prefer to be right? But what happened then is I got probably hundreds of song ideas back.
No way.
And it might be, well, Dr. Klasko, this might, thank you for this. This might be too radical for you, but we should really play it as Gil Scott-Heron's "The Revolution Will Not Be Televised" or something like that.
So give them an opportunity to interact with you.
And I would put that on and say, well, here's the, and it became this amazing way. And the reason I say that, the two things that have really brought my career together, and I bring this up in the book, are science fiction and music. Because you can have very difficult conversations through music. And you can also have very difficult conversations through science fiction.
Yeah.
When I wrote the book that you're talking about, Bless This Mess, which got me in so much trouble.
You got in trouble for this?
Oh, yeah.
Why?
Well, because it's...
Well, give us the gist of the book.
Well, so the concept is the United States healthcare system got admitted into the Intergalactic Council of Really Cool Healthcare Systems in 2035. And the person went back in time because we were so messed up in this era, and he wanted to know what happened. And so the reason I said science fiction is such a great tool, 1969, when Star Trek, had Lieutenant Uhura, who was a communication officer on the Starship Enterprise, but was African American.
Yeah.
And something happened, and she kissed Captain Kirk, who was a Caucasian captain. There was an outcry because in 1969 that didn't happen, and Gene Roddenberry's answer was, "Hey, it's 2305. I can't control what happened 2305." A lot of this book is how 9 different planets viewed healthcare in America. So one planet basically that had total value-based care.
They come here and they're like, "What the hell are you doing?"
I can't believe the United States in the galaxy, in planet Earth, in the galaxy Milky Way, had a system where insurers got 17 cents on the dollar to make sure that people who pay for the care, get the care, and provide the care, can't talk to each other.
Yeah.
Well, I got in a lot of trouble for that, but I said, hey, you can't blame me. It's the planet in the video, right? I mean, and so I think you can have more interesting discussions if you're willing to say, we called it, my colleague at Wharton, Greg Shea, we wrote 2 books together.
All right.
And every one of those books was a history of the future book. It's 10 years from now. here's an optimistic future of healthcare in America, here's a pessimistic future. What happened in 2022, 2023, 2024 to get us there? And my new video for my talks, I come back as the chief digital officer for President Taylor Swift. Because the Swifties became a party. And our healthcare motto is make it tailored to the individual and make it swift. Neither of which is true in 2023.
No, of course not.
So you can have those kind of discussions and people laugh. Or if I just got up and said, we are not tailored to the individual and we are way too slow, people say, how dare you say that?
Right.
Well, you can't argue with me as the chief digital officer as a hologram
That's
of
right.
President Taylor Swift. And since it's sort of funny,
Mm-hmm. Well, maybe it's not. Maybe it's reality.
well, it's reality funny. They sort of laugh, right? So,
Right.
so I think that my suggestion for all of us, even in your offsites and that kind of thing,
Yeah.
is let's talk about what things are going to look like in 2032. I worked at Apple,
Yeah.
and that was Steve Jobs' genius. Let's not look at tomorrow. Let's look at what's going to be obvious 10 years from now, and let's see what of it we can do today. Because then we'll beat Microsoft, Dell, and Gateway, who's going to look at next quarter.
Mhm.
And when you think about Apple stock being 15 when I was at Apple, that was 8,700 splits ago. And no, I did not keep my options. I probably own this building that we're sitting in. But I still get, the great thing about that is I still get like the first iPads and when they come out.
That's
So,
awesome.
yeah.
Well, let's then wrap with this
Yeah,
question.
sure.
So we have a lot to work on in healthcare, but we talked about a lot of good things that
Yeah.
you've done and a lot of people are doing.
And you've done.
Thank you. Looking at to President Swift in a decade or 2 decades, what's one thing that you're optimistic about? You're really excited about?
Well, I think I'm going to give you two.
Okay, two's fine.
Yeah. So
You've earned it.
I think the pandemic of 2033 will almost be a non-issue, because all the things that you're working with will have AI bots. We literally, behavioral health will start at home, through companies like NeuroFlow. We'll have 3D printers in our home, so that we'll have a customized mask, for those of us, who need it.
Yeah.
You'll drone deliver your food, so you won't have to go to the supermarket. So I think for the, technology will literally, and we'll have such rapid prototyping of vaccines and otherwise that even the miracle of the 6 month will become a week. So I think that's, all these technologies will come together in the pandemic of 2033. I think the other thing is, it's just something, as I've told you about, that I'm incredibly exciting. I think bioprinting and things like umbilical cord stem cells become a thing. There's a company I'm working
Those are really
with,
exciting.
United Therapeutics and 3D Systems, that, I believe that 10 years from now, 15 years from now, your child will basically go and say, Daddy, is it true that you're old enough to remember when if I needed a kidney, that somebody else would have to take out a kidney? That seems like really barbaric.
Right.
Yes, that's true.
That's
I
crazy.
am an old guy. But I think we're on the verge of that.
Yeah.
And those are the kind of things that I get excited about. And one of the things I'm so excited about NeuroFlow is you did this. You started out of passion with a great strategy, and that's something that my colleague came out to Nage always says. I want founders that are so passionate about what they're doing that's what they want to do for
This
their
has
spare time.
been so fun.
You're doing one of that.
I appreciate that. Well, you heard it there. In 2033, we're going to be the pandemic's not going to be an issue because of the technology.
And your stem cells will be able to
I love it.
recreate any organ you don't like.
It's so funny. Because think about like almost 120 years ago, we would be saying if you wanted to go to Europe, it would take 3 months, and now we're flying.
Or George Washington got treated with bloodletting and leeches. By the best doctor in the country.
Right.
And it wasn't like these people were stupid. That was pre-antibiotics. We used to go out on your horse and carriage, and you come in and do surgery without washing your hands.
Well, I'm excited about the future. Thanks to a lot of the work again that you're doing. Thanks for everyone that's listening. This is Bridging the Gap, and I'm Chris Molaro. You can learn more about what I'm working on at neuroflow.com. That's NeuroFlow.com. And on Twitter, I'm at Chris_Molaro. That's CHRIS_MOLARO, and NeuroFlow Live. Dr. Klasko, where can listeners learn more about what you're working on, find the book, all that stuff?
Yeah, so just get on sklasko.com, at sklasko. The latest book is published by the American College of Healthcare Executives. So
Awesome.
you can go on ache.org. Since I tend to go a lot of places, I might even meet up some of your listeners.
I love it. We'll put all that in the show notes too. Thank you again for listening, and we'll see you next time on Bridging the Gap.